Hey everyone, you are watching Blackboard and welcome to our Serology playlist. Serology is the scientific study of serum and other body fluids. In practice, the term usually refers to the diagnostic identification of antibodies in the serum. So the question is, when these antibodies are produced, such antibodies are typically formed in response to an infection against a given microorganism, against other foreign proteins, for example to a mismatched blood transfusion, or to one's own protein in instance of autoimmune disease. The assays used to identify and measure antibodies are called serological tests. Hence, these tests are diagnostic methods that are used to identify antibodies and antigens in a patient sample. There are several methods that can be used to identify antibodies and antigens, including enzyme-linked immunoassay known as ELISA, agglutination, precipitation, complement fixation, and fluorescent antibodies, and more recently, chemiluminescence. And we will talk about these methods in the next videos. Now, here are some applications of serological assays. These tests may be performed to diagnose infections. They are used to determine if a person has antibodies against a specific pathogen or to detect antigens associated with a pathogen in a person's sample. Serological tests are especially used for the organisms that are difficult to culture by routine laboratory methods like Treponema pallidum, the causative agent of syphilis. They are also used to diagnose autoimmune illnesses like rheumatoid arthritis, determining an individual's blood type, and in many other situations, such as to check if a person has immunity to certain disease. Serological tests may also be used in forensic serology to investigate crime scene evidence. Now, what does it mean if a person has a positive result? The presence of antibodies against a pathogen in a person's blood indicates that they have been exposed to that pathogen. Positive result for IgM suggests that a person is currently or recently infected, while a positive result for IgG and negative result for IgM suggests that a person may have been infected or immunized in the past. Antibody testing for infectious disease is often done in two phases: during the initial illness, known as acute phase, and after recovery, known as convalescent phase. The amount of antibody in each specimen, that is also called antibody titer, is compared, and a significantly higher amount of IgG in the convalescent specimen suggests infection as opposed to previous exposure. There are some factors leading to condition indicating that a person does not have a specific disease when the person actually does have the disease. Such false negative results can occur in people who are immunosuppressed, as they produce lower amount of antibodies, and in people who receive antimicrobial drugs early in the course of infection. So that's all about today's lecture. If you liked the video, hit the like button and subscribe my channel. Thank you.